I went to see my primary doctor, Dr. Raiza Perez, last December 2016. And she did the physical examination and she found out something on the neck. She recommended me to do an ultrasound, as I did, but later she recommended me to see the endocrinologist. Dr. Krieger called me and explained everything about the results. She mentioned the word cancer. That's very tough. As soon as she told me, she started talking to me about Dr. Urosman, so don't worry, he's coming, he's able to help. But I didn't listen to anything. I was like thinking on that word. That's very tough.
I had contact with her endocrinologist here, Dr. Diane Krieger, who's just fantastic. And we talked about the patient, and she had a small nodule. I knew she would do well with surgery. So I actually called her and chatted with her on the phone. So there are 4 kinds of thyroid cancer. By far, the most common is papillary thyroid cancer, which is what she had.
He explained everything again. He asked me if I have any questions. That made me feel very like I'm in good hands. Someone is trying to help.
She was actually my first patient when I came down here. I felt like I knew her before I ever had met her.
I met him here at Miami Cancer Institute, and that was funny because when I met him, I felt like I know him.
Thyroid cancer is really becoming an epidemic, not only in the United States, but throughout the world. And the question is how much surgery is appropriate for most patients. In her case, and in concert with her endocrinologist, we decided we just had to take out the thyroid lobe and not the whole thyroid gland. And in addition to that, she will not require radioactive iodine treatment. So those are all really nice things. And even better for her, she doesn't even need thyroid hormone. So she's living normally with her own thyroid gland inside without taking thyroid hormone. So it's kind of the best of all worlds for her.
I didn't have any pain at all. I waited like 3 days after surgery to start working again. But he told me that was perfect. As a doctor, as I told you, he's prominent. He's also a really, really good person. His human being is something that made the difference for me and my family.